Meningitis is the inflammation, usually caused by infection, of the meninges that surround the brain and spinal cord. The meninges are three fibrous membranes that protect the central nervous system. There are 5 different types of meningitis. 4 of these types are infectious. This includes bacterial meningitis, viral meningitis, fungal meningitis, and parasitic meningitis. The 5th type of meningitis is non-infectious meningitis, which can be caused by cancer, certain drugs, or brain injuries. Meningitis can occur in infants, children, and adults. While viral meningitis is the most common, the rare bacterial meningitis can be fatal. Any person is susceptible to meningitis, but it's more common in people whose bodies are having trouble fighting off infection.
There are 5 different types of meningitis: bacterial, viral, fungal, parasitic, and non-infectious. The first is bacterial meningitis. This is the most dangerous form. Bacterial meningitis occurs when bacteria enters the bloodstream and makes its way to the brain and spinal cords. It can also occur when bacteria directly invades the meninges as a result of an infection such as an ear infection. There are a number of different bacteria that cause bacterial meningitis, the most common being Streptococcus pneumoniae, Neisseria meningitidis, Haemophilus influenza, and Listeria monocytogenes. Neisseria meningitidis affects infants, children, adolescents, young adults, and older adults. Neisseria meningitidis, or meningococcal meningitis, is typically caused when bacteria from an upper respiratory infection enters the bloodstream. This is a highly contagious form of meningitis and is one that is seen on college campuses. Listeria monocytogenes affects newborns and older adults. Listeria monocytogenes can pass through the placental walls and infect the fetus. In cases such as these, the infants may be stillborn or die shortly after birth. Unlike any other bacterial form of meningitis, Listeria monocytogenes can be contracted through ingesting contaminated food, such as soft cheeses, hot dogs, and lunch meat. Bacterial meningitis can be contagious and can spread from person to person through the exchange of respiratory and throat secretions. This form of meningitis is not contagious by casual contact. However, if one is in close contact for a long period of time with an infected person, or if they are in direct contact with their oral secretions, they may contract bacterial meningitis. Healthy people can carry the bacteria that cause bacterial meningitis without getting sick in their nose and throat. A milder form of meningitis is viral meningitis. Viral meningitis is typically caused by enteroviruses. It can also be caused by mumps, herpes virus, measles, and influenza. This form of meningitis typically affects those with weakened immune systems and individuals who are under the age of 5. Viral meningitis is spread from person to person through fecal contamination and respiratory secretions such as saliva, sputum, or nasal mucus of an infected individual. Fungal meningitis is rare and is caused by the spread of fungus through the blood to the spinal cord. This form of meningitis is typically caused by different types of fungus, including Cryptococcus, Histoplasma, Blastomyces, and typically affects those with weakened immune systems. These fungi are typically found in infected soil. This form of meningitis is not spread from person to person and is not contagious. Parasitic meningitis is another rare form of meningitis. It is caused by a parasite known as Naegleria fowleri. This parasite enters in through the nose of an individual who is swimming in a freshwater place, such as a lake. The amoeba makes its way to the brain where it causes a fatal brain infection. Parasitic meningitis is not spread from person to person. The last type of meningitis is non-infectious meningitis. Non-infectious meningitis is caused by cancers, certain drugs, head injury, and brain surgery. This form of meningitis is not spread from person to person. The signs and symptoms of meningitis typically appear within 3 to 7 days of exposure. These symptoms include vomiting, nausea, increased sensitivity to light, altered mental status, fever, headaches, seizures, and a stiff neck.
To fully diagnose meningitis and create a treatment plan, the doctors will test blood and spinal fluid taps for bacteria and will often take a CT picture of the brain. Treatment for bacterial meningitis involves antibiotic therapy alongside therapy to control intracranial pressure and septic shock. Some new studies have shown that treatment with steroids might be beneficial to those with bacterial meningitis. These steroids are used to help relieve the excessive inflammation that bacterial meningitis causes, ultimately saving good tissue from being damaged while treatment is occurring. In the case of viral meningitis, treatment involves painkillers, hydration, and care to relieve the symptoms. There are a number of vaccines available to prevent some types of bacterial meningitis. An estimated 15% of bacterial meningitis survivors will be left with serious lifelong side effects. Some individuals who survive will be left with complications including hearing loss, visual impairment, epilepsy, memory loss, learning difficulties, scarring tissue, limb loss, or organ damage. Other survivors will make full recoveries without any side effects present.
Meningitis can be a life-threatening disease, but with your doctor, you are able to learn ways to make your life back to being whole. Many patients with meningitis can be healed from the disease and will have lifelong goals after. Only some patients do have long-term effects after contracting meningitis. Some of the following problems that can happen from people who have contracted meningitis and are now healed is they can have psychological problems, social problems, hearing problems, or behavioral problems. With a hearing problem, the problem is many people before they contract meningitis do not have a hearing test done regularly. With meningitis, it causes the inner ear bone to harden, which if you do not get a hearing test as soon as you get meningitis, it can cause complications with a hearing aid. If you catch the hearing aid fast enough or the hearing problem, you can have a condylar implant. With a condylar implant, you're able to implant it directly into the ear, improving the hearing than if an external hearing aid is added. Patients and families need to realize that with this disease, the patient themselves can not only handle the changes that are going with their body and through their social dynamics. Every patient and every family is different, which is why everybody needs a good support system around them, including doctors, friends, family, and psychologists. There are many different websites you can go to that have great information on meningitis. One of the top websites that I found was Meningitis Research Foundation. This website not only has great testimonies of people that have fought meningitis and are still battling it today but are healing gracefully, it also has good brochures in which you can order from online and be mailed to you from anywhere in the United States. It also has foundations in the UK and Ireland. Another great website is the National Meningitis Association, another website that gives great brochures and life stories of people that have battled meningitis. The next one is called Voices of Meningitis, which actually puts you directly in contact with pen pals who contracted meningitis and can give you a tutorial of how they survived their life and are continuing to heal today. And of course, one of the best websites to always look at when talking about diseases is the Center for Disease Control, or CDC, which constantly has great facts on many types of diseases throughout the world.
If you or someone you know thinks they are affected with meningitis, make sure to contact your primary care physician or walk into the Student Health Center on campus.